Hi, good morning. My name is Amira Wadmeles. My teacher is John Moscoso. My topic is activity of oral ALS-008176 in a respiratory syncytial. Methods. We conduct a randomized, double-blind clinical trial in healthy adults inoculated with RSV. Participants receive the oral nucleoside analogate or placebo 12 hours after confirmation of RSV infection or 6 days after inoculation. Treatment was administered every 12 hours for 5 days. Viral load, disease severity, resistance, and safety were measured throughout the 78 days study period, with measuring beginning before inoculation. That's one video of the topic.
RSV is a virus that we actually all probably get infected with every winter that makes us feel bad but doesn't make us very sick. It just so happens that in very predisposed populations, some of our specific preventative measures earlier than we typically do. There's little viruses and droplets that get in the nose or in the eyes and causing infection starting there. RSV starts off mostly with cold-like symptoms, just like any other cold that you and I know about. When it starts to become a problem in our former premature infants is when it gets in your lower airway. So a couple things that you'll see, they're just breathing harder. They may not be quite as pink as they typically are too. One very significant complication of RSV disease in a former premature infant, great resource. We tell parents whose babies are high risk that for the first winter they kind of have to be hermits. Stay at home as much as possible. Some risk factors are smoking, for RSV prevention, as for prevention of many other problems, hand washing is critical. So if you think you're sick, then unfortunately you may have to limit your exposure to the baby to the extent possible and realistic. Any excuse to breastfeed your baby is a good excuse. The immunity that you provide against RSV, diarrheal illnesses, and so many other things is really profound. We call breast milk nutrition, but we also call it medicine.
Okay, there was one video and we have the second
Little
video.
babies who wheeze very young get a disease called RSV, and they wheeze afterward. Does that mean they're going to be an asthmatic, or that the infection RSV is making them wheeze? What's that story about?
RSV is one of the most common viruses that children are infected with. In fact, within the first 2 years of life, virtually every child has been infected by this virus at least once. Most children who get RSV infection get nothing more than a runny nose, mild cough, which goes away in 5 to 7 days. But about 25 to 30% of these children will go on to develop wheezing and difficulty breathing, and some of these children actually end up in the hospital to care for these episodes. What we've learned is that the children who wheeze from their RSV infection do have a higher risk of developing asthma as they get older, but it is not a 100% risk.
The video.
Anything we can do so they don't get so sick?
Certainly. There are a number of different strategies that we use. The first, of course, is to try to minimize the risk of getting that infection at the earliest age. So we want minimal exposure to other children who may be carriers of the virus. We want to make sure that anybody who touches or handles these children wash their hands properly and are otherwise not sick. Once we take these usual precautions to minimize exposure, the next thing we do is to immunize these patients with a new vaccine. Give this vaccination once a month for a 5 to 6 month period during this hot, so the greater likelihood is that they would qualify. Children that are near term, 34 to 36 weeks, would need several.
Okay, that's it. Respiratory syncytial virus infections are a cause of substantial morbidity and mortality in various patient populations worldwide, including children. Globally, RSV infection were estimated to cause 3.4 million hospitalizations and 66,000 to 199,000 deaths in 25. In children younger than 5 years of age, primarily in the developing world, in the United States, infection causes substantiation, diseases, and cause of inhalation. Okay, we have
RSV. Kids who get it somehow seem more like having asthma attacks, wheezing attacks after we're over. Is that possible?
RSV, respiratory syncytial virus, is a virus that causes a condition known as bronchiolitis in children under the age of 2. Bronchiolitis is a condition where the child is wheezing and has difficulty breathing for a period of 7 to 10 days. What we know is that the RSV virus does cause wheezing disease. Once you diagnose the infection clinically, doing the nasal smear test to prove that it's RSV helps to identify the cause of that episode of bronchiolitis, since other viruses can cause bronchiolitis as well. Knowing that it was RSV infection certainly allows us to be prepared for infection within a 7 to 10 day period, and repeating the test would not help us plan treatment or predict outcomes.
okay. Viral load appears to drive the clinical manifestation of RSV disease. Higher viral loads have been associated with more severe disease in infants and children. 11-12 faster rates of RSV evidence are associated with more rapid improvements and hospitalizes children 13 and the often peak resolution of disease parallel the viral dynamics in adults. Okay, thank you.